What does it mean if it's yellow? Or what about if your mucus is green? Or how about brown? Ew! Or black or even red or like a burgundy color? I know you guys want to know, what does the color of your mucus mean? Well, I'm going to spill the tea today, but I got a few things to tell you first, so don't at me if you don't think I'm getting there fast enough. I am, but also stick around to the end because I'm going to tell you some stuff you might not have expected when it comes to mucus color. That is right. First of all, mucus is a good thing. It is not bad. Do not be afraid of mucus because, by the way, healthy people make 1 to 1.5 liters of mucus every single day. That's right. Mucus does a lot of things. It moisturizes airways. It traps bad stuff. And it's made up of like a lot of things. Water, protein, sugar, molecules that help get rid of the bad stuff, right? Kind of cool. So this is the thing. Mucus in and of itself is a good thing. What happens is we start to notice it when it changes. Either we develop allergy symptoms, or we get a cold or a virus or a bacteria, or we eat something spicy and our mucus changes and we're like, what's going on? And so you all are wondering, well, what does the color of the mucus mean? Well, let's break it down, okay? Here we go. Normal mucus is pretty much thought of as clear, thin mucus, right? Like that's the kind of mucus that you probably don't even notice on a day-to-day basis. Now, let's get to the yellow and green stuff because a lot of my patients will be like, I've got a bacterial infection, I need an antibiotic, my mucus is green. Well, this is the thing. Oftentimes, people with colds, bacterial infections, viral infections may have yellow or green mucus, but what's surprising about this is not necessarily so. The thing about it is the yellow and the green is not actually bacteria or viruses in the mucus. The mucus has actually changed colors because inflammatory cells and cells that are there to fight off the bad things have invaded the mucus to try to help. And the process has turned the mucus different colors, right? So keep that in mind because I'm going to come back to that to give you that surprising piece of information that you probably didn't know. Let's move on to brown or black mucus. Does not sound so good, right? Well, you can get brown or black mucus in people who are smokers, people who, take in tobacco with certain lung disease, fungal infections of the lung and in the sinus cavities. Not common, but can happen. Also like air pollution and things like that. Look, brown or black does not sound like a good thing. Let me tell you, if you got brown or black mucus, you need to be seeing your doctor, okay? So that's sometimes what we think of with that. Now, if we're talking about like a red or a burgundy colored mucus, well, the thing that I think about immediately is there blood there, like a drop of blood, or is there like, a little bit of blood, which can be rust colored or even bright red. So that is something very important as well. Now, this is sort of what I just gave you are like sort of the old standard, the gold standard ways we have thought about mucus. If you put in the Googler Schmoogler, what color does, my mucus is green. What does this mean? You'll get these charts that say clear, yellow, green, red, brown, black. And it says what I have just said to you. And what I have just said is not necessarily wrong, but this is the kicker that I need you to know. The kicker is that mucus color does not actually tell us what's wrong. That's right. So while, you could have green or yellow mucus when you have a bacterial infection, it doesn't mean you don't have a bacterial infection if your mucus is not yellow or green. Some people with a bacterial sinus infection have perfectly clear mucus or have other colored mucus, okay? Does that make sense? While color is fascinating and interesting, it is not the end-all be-all when it comes to determining and dictating what actually the problem is. So it's important to take note of what the color is. As your family doc, I want to know what, I don't always ask, patients tell me, what color is it? Okay, fine. But the color does not necessarily line up with the charts that you might find online that say, oh, if it's brown, this means you have a pneumonia or you're a smoker or da-da-da-da-da or da-da-da-da-da. So it's one piece of the puzzle, but it is not the main thing or even necessarily a large piece of what we use to figure out what's going on with you. We need a proper history and physical. That means we need to know, do you have fever, chills, are your symptoms getting worse, getting better? How long have they lasted? All that kind of stuff. And let me also tell you, the color of the mucus can also be influenced by things like how hydrated you are, how well hydrated you are, and other factors about your body. So you can take note of your mucus color. Totally fine to do, and let your doctor know what's going on, especially if it's red. Because, by the way, any blood, anywhere, if that's what we think is going on, we need to know about. But do not assume that yellow and green means X, brown means Y, black means Z, because we don't use the colors to definitively diagnose you. We look at the whole picture, which is what you want us to do. Guys, make sure you talk to your doctor about whatever's going on with your body. Any symptoms and all symptoms you have. That is very important. Run this mucus color question by your doctor as well. Let's see what they say. Guys, I'm Dr. Jen Caudle. If you have not subscribed to my channel and clicked the little bell for updates, please do. I do daily health videos on all sorts of topics. I am here every single day, so make sure you stay up with me and follow my videos because I got lots of great topics for you. Guys, I'm Dr. Jen. I'll see you soon.